Welcome to your IELTS vocabulary practice. You'll hear 25 questions. Each question comes with 4 options. Take your time, pause whenever you like, and try to choose your answer before the correct one is shown. Enjoy your quiz. Question 1. What is the meaning of aspect? Option A. A particular part or feature of something. Option B. The final result produced by something. Option C. The complete and total whole of something. Option D. The underlying cause behind something. Correct answer, Option A. The correct meaning of aspect is a particular part or feature of something. Example: regular sleep is an important aspect of overall health that is often overlooked in busy modern lifestyles. Question 2. What is the meaning of statement? Option A. A question raised to seek information. Option B. A private thought kept without sharing. Option C. A request made for a specific outcome. Option D. A formal declaration of fact or intention. Correct answer, Option D. The correct meaning of statement is a formal declaration of fact or intention. Example: the health director issued a clear statement reassuring the public that the water supply was completely safe to drink. Question 3. What is the meaning of gauge? Option A. To ignore and leave without measurement. Option B. To describe without using any figures. Option C. To measure or estimate something. Option D. To observe without drawing any conclusion. Correct answer, Option C. The correct meaning of gauge is to measure or estimate something. Example: a simple wearable device can help you gauge your daily step count and monitor progress toward your fitness goals. Question 4. What is the meaning of justification? Option A. An observation without any reasoning. Option B. A reason that shows something is right. Option C. A reason that shows something is wrong. Option D. An outcome achieved without any reasoning. Correct answer, Option B. The correct meaning of justification is a reason that shows something is right. Example: the research provided strong justification for extending the free community dental program to all residents over 60. Question 5. What is the meaning of legislation? Option A. Temporary rules applied in a single situation. Option B. Personal rules followed by an individual. Option C. Laws made by a governing body. Option D. Informal guidelines suggested without authority. Correct answer, Option C. The correct meaning of legislation is laws made by a governing body. Example: new legislation was passed requiring all health facilities to meet strict accessibility standards for patients with disabilities. Question 6. What is the meaning of bloom? Option A. Bud forming at the base of a stem. Option B. Flower that has fully opened. Option C. Leaf growing from a branch tip. Option D. Seed pod ripening in the sun. Correct answer, Option B. The correct meaning of bloom is flower that has fully opened. Example: the garden was full of life as every rose began to bloom under the warm spring sunshine. Question 7. What is the meaning of cabinet? Option A. Narrow drawer set used for documents. Option B. Open rack used for displaying goods. Option C. Cupboard for storing items or group of ministers. Option D. Single shelf mounted on a wall. Correct answer, Option C. The correct meaning of cabinet is cupboard for storing items or group of ministers. Example: The health minister addressed the cabinet with a detailed plan to improve rural healthcare access across the country. Question 8. What is the meaning of immigrant? Option A. A person who visits briefly for work. Option B. A person who returns to their home country. Option C. A person who moves to a new country. Option D. A person who travels without settling. Correct answer, option C. The correct meaning of immigrant is a person who moves to a new country. Example: the community health center provided culturally sensitive services to support the growing immigrant population in the area. Question 9. What is the meaning of door? Option A. Hinged barrier that opens to allow entry. Option B. Fixed wall that permanently closes a space. Option C. Sliding panel used to separate two areas. Option D. Narrow passage between two connected rooms. Correct answer, option A. The correct meaning of door is hinged barrier that opens to allow entry. Example: she gently knocked on the door before entering the patient's room to preserve their privacy and sense of dignity. Question 10. What is the meaning of threshold? Option A. Point at which something begins or a minimum level. Option B. Point at which something ends or a maximum level. Option C. Midpoint between two equal extremes. Option D. Random point without any particular significance. Correct answer, option A. The correct meaning of threshold is point at which something begins or a minimum level. Example: pain threshold varies significantly between individuals, and this must be taken into account during clinical assessment. Question 11. What is the meaning of fictional? Option A. Existing only in imagination or story. Option B. Recently discovered and not yet confirmed. Option C. Verified as real and documented fact. Option D. Partially based in fact and partially imagined. Correct answer, option A. The correct meaning of fictional is existing only in imagination or story. Example: the fictional hero in the children's story taught young readers about the importance of kindness and looking after their health. Question 12. What is the meaning of sovereignty? Option A. Supreme authority and independent power. Option B. Advisory role with no power to decide. Option C. Shared governance between two equal partners. Option D. Limited authority granted by a higher power. Correct answer, option A. The correct meaning of sovereignty is supreme authority and independent power. Example: the nation celebrated a century of sovereignty with cultural events honoring the resilience and unity of its people. Question 13. What is the meaning of hysteria? Option A. Quiet and entirely composed response. Option B. Mild and briefly emotional reaction. Option C. Uncontrolled and extreme emotional state. Option D. Perfectly calm and fully rational state. Correct answer, option C. The correct meaning of hysteria is uncontrolled and extreme emotional state. Example: mass hysteria over an unverified health rumor led the clinic to issue a clear and calm public statement of reassurance. Question 14. What is the meaning of transmission? Option A. Method of preventing something from spreading. Option B. Process of blocking something from passing. Option C. Process of passing something from one to another. Option D. Act of keeping something within one location. Correct answer, option C. The correct meaning of transmission is process of passing something from one to another. Example: early identification of infection allows health authorities to interrupt the chain of transmission before it spreads further. Question 15. What is the meaning of rouse? Option A: stir someone from sleep or stimulate action. Option B: observe someone without influencing their state. Option C: leave someone undisturbed in their current state. Option D: settle someone into calm or sleep. Correct answer: Option A. The correct meaning of rouse is stir someone from sleep or stimulate action. Example: the community leader worked to rouse public interest in the free health screening event through social media and local radio. Question 16. What is the meaning of temper? Option A: completely uncontrolled emotional state. Option B: emotional state or moderate something. Option C: complete absence of any emotional reaction. Option D: fixed emotional state that never changes. Correct answer: Option B. The correct meaning of temper is emotional state or moderate something. Example: she managed to keep her temper calm during the tense situation and responded to the patient's anger with patience. Question 17. What is the meaning of diverge? Option A: follow a parallel course without ever meeting. Option B: remain on the same path without separating. Option C: move in different directions from a point. Option D: move toward the same point from different places. Correct answer: Option C. The correct meaning of diverge is move in different directions from a point. Example: the two research teams began to diverge in their conclusions as new evidence emerged from separate clinical studies. Question 18. What is the meaning of suspend? Option A: to temporarily stop or hang from above. Option B: to permanently end without resumption. Option C: to observe without stopping anything. Option D: to evaluate without any effect on continuation. Correct answer: Option A. The correct meaning of suspend is to temporarily stop or hang from above. Example: the outdoor sessions were temporarily suspended during the heavy rains and moved inside to the community hall instead. Question 19. What is the meaning of condenser? Option A: component that heats liquid into steam. Option B: mechanism that filters particles from liquid. Option C: device that cools vapor into liquid. Option D: tool that separates mixed gases into parts. Correct answer: Option C. The correct meaning of condenser is device that cools vapor into liquid. Example: the engineer replaced the faulty condenser in the cooling system to restore normal function to the entire unit. Question 20. What is the meaning of execute? Option A: abandon a plan before it is carried out. Option B: carry out a plan or task effectively. Option C: observe a plan being carried out without helping. Option D: review a plan without putting it into action. Correct answer: Option B. The correct meaning of execute is carry out a plan or task effectively. Example: the health team worked carefully to execute the emergency response protocol exactly as it had been practiced in training. Question 21. What is the meaning of identification? Option A: the process of concealing something or someone. Option B: the process of observing without recognition. Option C: the process of recognizing something or someone. Option D: the process of replacing something or someone. Correct answer: Option C. The correct meaning of identification is the process of recognizing something or someone. Example: early identification of health risks allows communities to take preventive action before serious problems develop. Question 22. What is the meaning of emigrant? Option A: person who leaves their country to live elsewhere. Option B: person who travels abroad for a temporary visit. Option C: person who returns to their country after living abroad. Option D: person who arrives in a new country to settle. Correct answer: Option A. The correct meaning of emigrant is person who leaves their country to live elsewhere. Example: the emigrant carried her family's medical records, carefully knowing that continuity of care would be important in her new country. Question 23. What is the meaning of infectious? Option A: spreading only through contaminated food or water. Option B: spreading only through direct physical contact. Option C: spreading easily from person to person. Option D: unable to spread between individuals. Correct answer: Option C. The correct meaning of infectious is spreading easily from person to person. Example: some infectious illnesses can be prevented through timely vaccination, making immunization programs truly vital for community health. Question 24. What is the meaning of purity? Option A: state of being free from impurities. Option B: condition of having a moderate level of impurities. Option C: quality of varying in cleanliness without consistency. Option D: state of containing significant impurities. Correct answer: Option A. The correct meaning of purity is state of being free from impurities. Example: the purity of the medication was tested at the laboratory before it was cleared for distribution to health facilities. Question 25. What is the meaning of utilization? Option A: the act of observing something without use. Option B: the act of storing something without using it. Option C: the act of evaluating something before use. Option D: the act of making practical use of something. Correct answer: Option D. The correct meaning of utilization is the act of making practical use of something. Example: efficient utilization of community health resources ensures that every available service reaches those who need it most. This is the end of Part 7. See you in the next quiz.